Today we're going to be discussing how to put on a knee brace. This is a common brace that we put on for postoperative patients. It's called a telescoping knee brace, and typically we put this on in the operating room so it will come positioned on your knee. However, there are several key things that we want you to keep in mind for when you get home, because especially after you take the dressing off and the swelling has gone down, you might need to adjust the brace. The first thing that you want to adjust is basically the length of the brace. And most braces are very similar to this T-scope brace. You can basically unlock this little tab right here. If you unlock it, then you can extend it. And this is the thigh portion. So you want to get this little hinge right here, right centered over the knee. And then this, there's little numbers here on the side. They'll go 1, 2, 2.5, 3. You want to get it at the appropriate size, then click it into place. And then you'll do that same thing over here on this opposite side. So you want to bring it up to whatever corresponds to the other side, click that into place, and that'll lock it. Then down on the tibia side will be the exact same thing. If you open this up, then you can telescope this down to make it as long as you need it to be. Typically, you'll want it to be about just right above the ankle. So for this particular patient, you'll want it to be these down or these bottom pads right here. You want to be just a little bit above the ankle. So we're going to show how to do this with this particular patient. So the first thing is you'll want to center the hinges or the dials that tell you how much motion that you're going to have right over the knee. Then what you want to do is there's Velcro tabs that you can allow to pull that, and then you can sort of tap those down. Then you'll come in here, you'll pull this there, and then take this, pull it tight so that it really gets tight on your ankle or just below the knee, and then the ones on the thigh. Okay, so that's how you do each of those little straps. Then on the brace, there are little dials that'll tell you how much extension you can have and how much flexion. Typically, this red button is always down in the down position, and that will lock the brace. And so you've got one on each corresponding hinge. So if you have those up, then that allows the knee brace to bend. But for most of the time after a knee surgery, you're going to want to have those in the locked position so that you can walk around with the brace on, and so the brace does not bend. Just in case you fall, you want to make sure that you don't bend the knee, and this brace will help prevent that. Once your surgeon allows you to do more range of motion, then you can unlock that by pushing it up. And then there's these little levers right here. So for example, if your doctor says you can bend it to 30 degrees, you'll push that to 30 degrees, and that only allows it to bend to 30 degrees. Once your motion improves and the therapist or your doctor says that you can unlock it, then you can start to unlock it to 50 or to 70, and then fully unlocked is all the way to 110. Again, if you have it unlocked and you're getting up and you want to lock it fully, you just press that down, and then that locks the brace. If you have to adjust it at all, it's very easy. You've got these little Velcro tabs right here, and so you can basically just pull the straps, push that down, and that will lock it in place. If these are too long, then you can cut these straps so that they're just a little bit shorter. You take the Velcro off, you'll slide this down, and then you can cut this extra strap off and then just put this Velcro back on, so then you can then do it to the size of the patient's knee. So we're going to get this to the size of her knee so that we can really make sure that everything is the appropriate length. Again, you want to put that hinges right centered over her knee. Then this one's already been adjusted, so we can just lock that in place. This one will have to adjust the length of it, but this should be done in the operating room. But once your swelling goes down, you might have to tighten these back up again. So again, you unlock this little Velcro tab, you pull it through here so that it is the appropriate length, then you pull right here, And then you can use this in order to go back around in order to be down and put the knee brace in the appropriate position. Again, you want to do this for all the other tabs or for all the other straps. And so now you've got the brace appropriately positioned on the leg. That's it for this. Hopefully this instructional video is very helpful for your postoperative brace wear. Thank you.